Hello and welcome. My name is Mary. I am a physiotherapist. The 10 top exercises that I like to prescribe my patients when they come to me with quite intense knee pains. That might be knee osteoarthritis, that might be related to your meniscus. Different structures in the knee can give you some pain, and sometimes you don't know which area it is. If you are looking for exercises that are gentle, that can help to continue to lubricate the joints and continue to activate the muscles and just make you feel a whole lot better, then this video is for you. My top 10, here we go. The first exercise is a range of motion exercise. I'm going to point the camera down to my knees, straighten out that knee, and then bend it in. As I bend it in, I can get a nice calf stretch as well. You never look at the body in isolation. Often with knee pain, the calf will get a little bit tight, the ankle will get a little stiff. Range of motion throughout the day can help prevent that pain that we get when we maybe stand up after sitting for a long time. Number 2, we're going to stay down here for a moment. Knee extension. So knee extension looks just like as advertised. And what you want to do is really set the quad. So I like to prescribe holding that exercise for 5 seconds. It's a lot tougher when you do so. And now for some people who are a little stronger on the outside of the knee versus the inside, and this is quite common, doing a knee extension but slightly turning the foot outward can activate more of that inner thigh as well as the quadricep on the inside. It biases what's called the VMO, vastus medialis obliquus, if you're fancy. That's our number 3, knee extension with a little bit of a foot turned out for an inner thigh activation. So the next exercise in the knee is an isometric exercise where you're actually activating a little bit higher up the chain. So why is this helpful and important? When we have strength through the hip, we have better tracking in the knee, especially when we have quite a bit of discomfort and we're just starting to get over that knee pain. Making sure that the hips stay really strong around the area is valuable. Pressing into our hands on the outside of the knees and relaxing. For some people, using a TheraBand works as well, and then you're coming in and out. So that is number 4, hip abduction. Number 5, knee exercise we're going to do over here on the treatment bed. It's time for a straight leg raise. So the straight leg raise is working through a little bit more range. It's a little more challenging. And what you want to do with this is try to keep that knee nice and straight as you raise it all the way up and all the way back down. Number 6, hamstring and calf stretch. My hands behind this area and just relax into that stretch. The hamstring muscle has tendons that insert on either side of the knee, and those can get tight as well. So it's really valuable to stretch that area out because that means less forces on the knee. The calf stretch, having the hands a little higher up. For people who maybe have a little more tightness there, you can have a band, a waistband or a belt, and hold that there on the base of your foot. 7, bridge. So bridge is going to fire the quadriceps as well as the gluteals to think about keeping the knee and hip lined up. Finding that nice activation throughout and coming back down. 7, if that's feeling really good for you and you feel like you need a little bit more of a challenge through the quadricep, you can come into that single leg bridge. Just know that's quite a lot of work for this area. So if you're in a lot of pain, for some people, this might be way too much. But it's important to be working the whole body through this exercise. You don't want to just hinge up through your back and kind of kink into your back here. You want to really try to feel that pressing into your heels and feel that in the glutes. Number 8, keeping the hips nice and mobile as well, because this will get tight when you have a knee injury. Press into your knee just opening up the inner thigh, opening up this area of the thigh and the hip. And you can do the other one as well, to make sure that in case you're compensating and limping around, that this other side isn't getting too tight. Number 9, this one is meant to get a little bit more of a knee bend. So what can classically happen as you deal with that acute discomfort is you get a little bit of swelling. So heel slides will allow you to make sure that you're getting as much range of motion as possible in that knee, and typically because of inflammation and swelling, that maximum range is challenged. Coming in and out periodically of this knee flexion and full extension is going to absolutely help you to make sure that that heals a lot faster and that the stiffness associated gets better as well. Getting up from the chair can be uncomfortable for the knee, but it's also an opportunity to load the knee a little differently, load it in a way that's not as much pressure on the knee, and using your gluteals a little bit more. I want to try to press into my heels, rock forward, and squeeze my bum. As I'm coming up, it's as though I'm perched, as though I'm about to sit back on the chair. So there's not a ton of force through my knee. I'm not moving up by pressing in to the front of the knees like so. I'm coming up and really pressing into my heels and lifting up by straightening my legs. Kind of like a squat. And you can practice this if this is pain-free, or if it's a little bit uncomfortable, you can use it as a strategy to get up from your chair. I want to offer progressions for these exercises as well, and encouragement that you can get back to doing the things you love. But we know that irritation through this area requires a lot more strength. So the process of strengthening does take 3 weeks to 5 weeks. So please be patient and do your exercises diligently. Thank you.